So oftentimes when people ask me what I would recommend is like the first entry point for a psychedelic experience, I say float first.
Mm-hmm.
At least float. Because then you know if you're able to get close and personal with the unknown, if you're able to get close and personal with your own stuff,
Mm-hmm.
and how you respond when it gets really uncomfortable. Because if you can't hold your stuff together in the tank, you're not going to be able to hold your stuff together very well in the ceremony.
Right.
And so it's this awesome accelerator of personal development. Particularly, I don't know if you know Kevin Johnson at Zero Gravity in Austin.
Yeah.
Good guy. I've gotten to know him, and I was living in Austin for about 6 months last year, so I got to know him pretty well. And we had some great conversations about the tank, and like he did 100 floats in 100 days. And
right.
he's really zoned in, and it's more and more as we're appreciating the psychospiritual benefits. We're also now, because the Western mind wants to know, and we want to research what's happening physiologically. So we're starting to build more and more of the biohacking kind of metrics before and after floating, and what it's doing to the neurochemistry, what it's doing to the hormonal state, what it's doing to the resting physiologic potential, to our nervous system, and moving from sympathetic overdrive into more of a parasympathetic state or an alpha meditation brainwave state. So there's a lot of really cool ways to slice that onion about what's happening in the tank, but across the board, when people do a series, and this is what made me think about Kevin, is that's how he approaches floating. He's like, flotation is like meditation or yoga or anything else. It's a practice. Let's approach it like a practice. It's not something where you would just do a one-off in the gym and you'd think that you were going to get like swole and buff and like, hey.
Yeah.
Right? But let's use it as like it becomes a dedicated practice. And when people stack the therapies,
right.
And so if I'm working with a client, they're coming off of benzodiazepines or pain relievers or alcohol, not to say that anybody should cold turkey alcohol, I can't make that medical recommendation, or benzos for that matter, but as an adjunct to help calm the system when there's an over-amplification of fear, which all of those medications, so to speak, benzos, alcohol, opiates, all of those kind of subdue the system. When you come off, there's this explosion on the other side, a lot of fear and anxiety. Same thing when people have anxiety or panic. The tank has ability to soothe and start to smooth out those waters.
Right.
So people get more rested and connected with their breath. They're not so in survival mode scanning the environment. The nervous system isn't calculating sight and sound and vestibular orientation, gravity. It's like, okay, now let's drop into the deeper aspect of the human form. Let's get back in touch with our breath and start to peek into those, like Joseph Campbell says, in that cave that you fear lies the treasure that you seek.
Yeah.
Right? What are all those little things that we're not paying attention to? And when you drop into the tank, there's a lot of opportunity to look at that stuff.